With due respect of the dignitaries, I am concluding this session and handing over the mic to Dr. Prachibari and Dr. Vidya Kharat for our next session.
Hello everyone, good afternoon. Honorable dignitaries, distinguished guests, esteemed speakers, and enthusiastic participants, a very good afternoon to all of you. I, Dr. Vidya Kharat,
And Dr. Prachibari.
a coordinator of this session, feel privileged to welcome you all on the behalf of the Organizing Committee Day 3, International Conference Sushrutee 2024, the Womb and Wound Saga on Infertility. We are thrilled to witness such a enthusiastic participants and all the highly learned audience gathered to deepen their understanding of this significant topic.
Nowadays, reproductive problems in both men and women are rising at an alarming rate. Infertility has significant negative impact on the lives of couples and eventually community. Today's session aims to bring the light on men infertility. We have honored to have with us an incredible distinguished speaker, an expert who have made meaningful contribution in the field of OBGY. He has a wealth of knowledge and experience, making this seminar not only informative but also an enriching experience.
Now, moving ahead with the session, I would like to invite respected Dr. Narendra Meena sir, Associate Professor of GAC Udaipur, Rajasthan, and Dr. Dhiman Kamini ma'am, the Nima President, on the stage. Okay. I would like to invite respected Dr. Narendra Meena sir and Dr. Dhiman Kamini ma'am, the Nima President, as a chairperson on a stage.
Now I would like to request now I would like to invite our today's esteemed guest speaker, respected Dr. Tushar Panchanadikar sir, to grace the dais.
Thank you, sir. Thank you, ma'am. Now, I will request Dr. Vivek Jog sir to represent a bouquet to welcome Dr. Dhima Kamini ma'am on the stage.
Thank you, sir. Next, I would like to request Dr. Dhiman Kamini ma'am to welcome our guest speaker, Dr. Tushar Panchanadikar sir.
Thank you, ma'am. Now, I would like to introduce our chief speaker today, Dr. Tushar Panchanadikar sir. He is a professor of OBGY at Bharati Vidyapit, Deemed University Medical College, Pune. He is a ex-HOD and ex-deputy medical director at the Bharati Vidyapit, Pune. He has done his MBBS DGO MD from BJ Medical College, Pune. He is a chairman of a ethical committee Sanjeevani Hospital at Pune. He is invited as a speaker at All India Congress OBGY, FOXY and FIGO conferences. Now,
Okay, I would like to request Dr. Vivek Jog sir to welcome our chairperson, Dr. Narendra Meena sir. Really, we are fortunate to have such dynamic speakers with us today. Now, without any further delay, let's start with the session. We encourage each one of you to actively participate in this interactive session. Kindly reserve your questions for this segment. Your insightful queries greatly contribute to the wealth of knowledge today. Now, we would like to request our honorable speaker to start his session. Please, sir.
Yeah. गुड आफ्टरनून एवरीबॉडी। शायद खाने के उपरांत में आपसे बातचीत करना आप पसंद करेंगे या नहीं मुझे पता नहीं, लेकिन कोशिश तो ज़रूर करूँगा कि जो कुछ डिस्प्ले किया जाएगा आप उसको लाइक करेंगे। एट द ऑनसेट आई thank the chairpersons who happen to be the office bearers of NIMA, National NIMA, for giving me, and the organizers, Sumati Bhai, Sham Mahavidyalaya and my own Bharati Vidyapit for giving me this opportunity for delivering a talk for you on approach towards male infertility. Yeah, points to be there in this presentation will be introduction, basic facts, evaluation of history taking, clinical evaluation, evaluation by investigations, treatment approach and conclusion. Respected chairpersons, if I do overshoot the time, please let me know. I will stop. नहीं लेक्चरर हूँ, प्रोफेसर हूँ, 45-50 मिनट बात करने की हमेशा आदत होती है, और जब हम सीनियर हो जाते हैं तो पता नहीं कोई हमें रोकता भी नहीं है तो ये आदत बढ़ जाती है, इसके लिए आप महामहिम दोनों हो तो मुझे कृपा करके कह देना कि आपका टाइम हो चुका है. Definition of infertility. I mean, how many are Marathi speakers over here? Marathi language, practically everybody? Okay. I'll talk in multilinguistic manner. The definition at my time when I was a resident was very simple. 2 years of marriage and no conception is infertility. When I started teaching, it has reduced down to 1.5 years. Now it has come down to cohabitation. Okay. Now I don't know, but live in relationships which are faithful for 1 year. And then they are trying to get conceived, then it is fertility, not the infertility, and their willingness. Therefore, nowadays it is said that if there is cohabitation without using any contraception for a period of about 1 year, then it is called as infertility. This amplitude of infertility is phenomenal. You just can see that around 15 to 17% overall worldwide are infertile couple. That means out of every 6 couples, there is 1 couple which is infertile. And if you can calculate that 100%, 40% is to the female, 40% is to the male, 10% is for both, and remaining 10% is unexplained infertility. So this is the magnitude and amplitude. Then why males first? I always say that males are to be investigated first rather than females. हम जो है, हमारा वीक क्रोमोसोम है Y, फिर भी हम समाज में डोमिनेंट है. गलत है. Okay, that dominance should be crashed. And whenever a couple approaches you, then you should be able to say that if I want to investigate, I will investigate the man first. And the second thing is that causes of female infertility are quite many, but they are treatable, more treatable. Causes of male infertility, once you find a male, it is very difficult to treat. And that is why this introduction was important. Some of the basic facts. Structure. I'm not going to go in details of that. It is there on the screen. What is more important is this, the acrosomal cap. The tail is also important. Mitochondria are also important. They are there as energizers. They take fructose and they energize and they do everything. But what is the role of chromosomal cap? It's capacitation. What is capacitation? It's the property where a sperm gets into the vagina and have interactions with the fluid in the vagina, the contents of the vagina, and can literally swim. These are the interactions of the sperm with the vaginal fluid, and therefore it can go ahead through cervix and it can go ahead to the fallopian tubes ultimately. An acrosome reaction, that is what the acrosomal cap is very important. Acrosomal reaction is the capacity of the sperm to penetrate the ovum. There are many questions why there are many to grab to and why only one succeeds. Maximum 2 to produce dizygotic twins, but many of the times it is only one. Because when this acrosomal reaction is there, then it binds the outer granulosa cells of the ovum and drive the other granulosa cells and get the ova sealed. And when that ovum is sealed, no other sperm can enter. So that is very important. And now approaches with different things. We are going to evaluate how can we approach towards the male infertility through history taking. Age. हम ऐसे कहते हैं कि मेल कोई एज नहीं होता है. He is fertile forever. Maybe last 20 years of its century is 80 years probably. The fertility capacity of the male is quite the same. But look here. This goes down. This goes down. Maximum fertility by a male is 90% within third decade. As against it goes from sixth decade onwards, it goes to 10%. So age does matter. Occupation. Laborers, foremen, wrestlers, bodybuilders, soldiers, professionals, executives, travelers, sailors, pilots, IT professionals, police security guards, supervisors, unemployed. Unemployed men are fertile. त्यांना काहीच नसतं करायला शिवाय एक. And the other thing is, why I put it in red is IT professionals, because they work from some other nation. They do not work for India. हस्बैंड करता है यूएस के लिए काम, वाइफ करती है जापान के लिए काम. एक की सुबह एक होती है, दूसरी की रात किसी और की सुबह होती है. पैसा तो कमाते हैं बेचारे, लेकिन अधूरे रह जाते हैं. सो दिस इज द मेन थिंग. एंड द लास्ट सेंटेंस. Yeah. The big screen. Give me the big screen.
कौन सी स्लाइड है?
Screen use there.
कौन सी इसमें?
हाँ. Yeah. Yeah, we were on this slide. See the last sentence and the two emojis. Okay, these are smokers and alcoholics. They are more enthusiastic, not good performers. Okay, therefore infertility can be there in other form of not only libido, but impotency. So these habits are not directly related to infertility, but these are the very two important factors of infertility. Then these are very common: traumatic and infective, scrotal injuries, mumps in the childhood, orchiditis, UTI and prostatitis. More the age, more is the chance of prostatic enlargement and can be a chance of UTI resulting into prostatitis or prostatitis resulting into UTI. And that is one of the reasons why after 50 or after 60, the male goes down for the fertility. Then comorbidities, hypertension, diabetes, and some of the cardiac diseases which crop up, maybe ischemic cardiac diseases, which are more common. And it is said that one of the exercises to be done is sexual exercises. Okay, the people may not be able to do that because of the ischemic heart disease. And this can be as a very important comorbidity apart from hypertension and diabetes. This is very important when I say that it is coital history and impotency. Whenever any couple comes into the consulting room, थोड़ा पानी मिलेगा क्या? Then you must be asking that couple very openly about their coital history. See, coital frequency is that couple's purview, no doubt about it. But you should ask. See, it can be daily, it can be sometimes 2 or 3 times in a day. But generally, couples settle down by 2 to 3 times a week. More the age, less is the frequency. And therefore, that IT professionals come here again. They wish to, but they can't. And they find a new solution for it. They are plentiful of money. They just go for ovulation detection, get the kit at their home, get the ovulation date, and have the copulation on that day. This is not done. This is like taking tablet of copulation on the day of ovulation. Okay, ovulation is not perfect on 14th day. Ovulation can be there from 12th to 18th day. Therefore, the common advice which I give to the patients is 10 ka rule, 10 rule. First day of the cycle, mark it as 1. From that, count to 10. And 10 days from that is your fertile zone. Very easy to say. So it is rule of 10. From 10th day for next 10 days, they should practice in whichever way, at least 2 or 3 times in that, because the sperm life is 48 to 92 hours. But the ovum's life is just 12 to 24 hours. So if you are considering that ovulation to be positive on the test, this might have had happened around 10 hours back. And when you have a coital activity, that ovum may be in a position to reject the entry of the sperm. Therefore, that is very important. And then you are going to ask in details about the coital problems in the male, in terms of erection problems, penetration problems, ejaculation problems. And again, I have done it in red. You agree or not, but this is very common a problem, very common in males. They will not disclose. But counseling should be there initially together. Later on, ask a wife and she will tell you the problem. Or a man says to his wife, will you please be out for a minute or 2? And then he tells you the truth. क्या होता है पता नहीं सर, हाँ चाहत बहुत होती है लेकिन premature ejaculation होता है. If these are the things, you should be there in a position for the andrologist. I am not. But you are going to refer that to the andrologist to tackle the problems with functionality of the coitus. You may be wondering why I am so concentrating on coitus, because it is the main thing for fertility. Unless and until you have that, you cannot go ahead to call it as a fertile or infertile couple. Now, clinical evaluation. Height, weight, general appearance, and hair and fat distribution. Do you know this? This is Klinefelter syndrome, XXXY. Okay? These are the men who are not capable of conceiving. This is chromosomal disorder, and therefore, if you get a person with such gesture and gait, you can think of. This is very important. This is preferably to be done in standing position. Counseling and consent. This is very important nowadays. See, whenever you are examining with your due authority as a doctor the genitals of humans, you need to have the counseling and nowadays a consent also. This is especially true when you are examining the opposite sex examination. For example, we are always told that female is to be examined with the presence of an attendant. This is especially true for the male gynecologist. Similarly, a male is examining a male gynecologist is examining a male. Don't take it for granted. Therefore, take an attendant with you, okay, and then go on examining a male. That is very important. It holds true for females also, it holds true for males also. Scrotal examination. Size, rugosity, hair, and raphe, central raphe. Testicular presence and descent. See, many of the times, even in adulthood, you may find the testes in inguinal canal. And sometimes you may not find them in the inguinal canal, then it is cryptorchidism. That is hidden testes. You will not get it. See, it is very simple. Gonads are there in the center. If it is going to be the ovum or ovary, it ascends up. And if it is going to be the testes, that gonadal structure descends down. So this is the main thing. So whenever gonads have to be there in scrotum for males, they have to travel through the inguinal canal and then come into the scrotum, and then you have the bilateral presence of the testes in the scrotum. Do you know orchidometer? It is available on Amazon also. काही नाही, सोपं आहे, हे असं असतं काहीतरी. Okay? This is to compare the testicular size of an individual. Wherever I have marked red as a tick, these are normal testicular volumes. Okay, whatever is less than 15 ml is hard to have the fertility easily. Testicular reflex. What is testicular reflex? Vas palpation and testicular sensation. Testicular sensation is that try to grab a testis and try to press it a little. Typical, there is a pulling sensation in the abdomen. This is indicative of active testes. If there is a seminoma, tumor of the testes, this sensation is lost. Testicular reflex is the one where you tap the medial aspect of the thigh and the testes are taken up. This testicular reflex is pronounced in children, but it is also there in adults. Therefore, I have said that better to examine an adult for infertility in standing position. Vas, if you can palpate, you palpate. It's very easy to palpate vas because we were doing vasectomies also one day, but nowadays nobody does vasectomy. So clinical evaluation continues. Penile examination. size, the first thing to be told to the patient is assurance. There are misconceptions and taboos with the size of penis. Size doesn't matter. What matters is erection. And for that, there is something which is chordae. Do you know something about chordae? There are fibrous bands which are attached from the scrotum to the base of the penis, and that will not take the erection up to the mark. जसा टाय टंग असतो ना, टंग टाय, तसं हे कॉर्डी असतं. जशी कॉर्डी टेंडिनी इन हार्ट असतात तसे हे कॉर्डी असतं. बट यू नीड टू एक्झामिन दॅट. Apart from that, glans is to be examined for any ulcers. Coronal sulcus is going to tell you about the hygiene of a man. Phimosis is very common. Take it from me, it is very common. You try to reduce the prepuce and it doesn't go back. And whenever you hit that coronal sulcus, if the hygiene is not good, coronal sulcus is full of smegma. And that indicates that the patient is not taking proper care during his bath. Every bath has to be there. Every bath has to be there with cleaning. Semen analysis, very common. The chit has come that I am running out of time. Shall I continue for next 5 to 10 minutes? 5 minutes? Preferred method is masturbation. I think I was given around 40 minutes. 45, took it as 15 minutes आने के लिए 30 minutes तो होना चाहिए. Okay, anyway. The method is to preferred in lab. If it is taken at home, it should reach the lab within 60 minutes, maximally by 2 hours. Is to be contained in wide mouth without rubber content. त्याला काय ऑटोक्लेव वगैरे करायचं नाही. Okay, it should not be that sterile also. You can just ask the patient to collect it in the container. It should be preferably a full amount. And if that full amount is not collected, you should ask your patient that, better report that. 2 to 5 ml is the thing. In that, if some 0.5 also is lost, it goes for bad values in the total ejaculate. Therefore, don't hesitate to ask your patient to ask about his spillage. Transport at normal temperature. Nothing like cold chain. Semen analysis, there can be a big talk on this. Okay, but this is WHO standard of 2010. I have not put in, but it has been revised in 2022. And there are no much differences. It is just the same. And these are the standard cutoffs. These are the standard cutoffs for semen analysis. One of the reports of my friends who does a very nice semen reporting. This is first for morphology. Second, first for general appearance, second is for details. Third one is there for sperm morphology, and lastly he gives the pictures also. So this is what the half-page semen report was there. Now it is coming to 4-page semen report. But if you get it, it is better. By investigation, scrotal ultrasound. Only thing is specialized person, 9 to 15 megahertz. The probe, and it has been in one position. If the patient is kept in left lateral, it has to be kept in left lateral. Do not do like for left test is left lateral and right test is right lateral. It has to be there. Why? Because we need to evaluate varicocele more. So that is the main thing. Then hormonal investigations, FSH, LH and testosterone. The things are different. Testicular biopsy is again vas palpation. Investigations continued with this. This is HPT axis. Hypothalamo-pituitary testicular axis, not thyroid axis. Like HPO, this is HPT. This is that axis. And this is the feedback system. typical negative feedback system, and you are going to get something which is called as hypogonadotrophic hypogonadism, which is HH. ऊपर ही नहीं है तो नीचे क्या मिलेगा? These are the different techniques: PESA, MESA, TESA. Okay, PESA is percutaneous epididymal sperm aspiration. MESA is microsurgical epididymal sperm aspiration, and testicular sperm aspiration is TESA. Now the last part of it is treatment module. Medical, surgical, ART. I'm not going to touch anything about ART, it's a huge topic. Medical approach, there are many things: anti-estrogens, clomiphene citrate and letrozole, injectable testosterone, once upon a time very much used. I have given a big cross. Recombinant HCG in hypogonadotrophic hypogonadism, 250 micrograms per week for 12 hours. Bromocriptine, alpha blockers, corticosteroids, FSH, not so effective. Antioxidants, you can say anything about it. And nutraceuticals, where I want real integration from allopathy to Ayurveda to homeopath, because we are very bad in nutraceuticals. I have no hesitations. आम्ही डाएटचं काहीही सांगतो ते काहीही खरं नसतं. Okay, so there should be the thing of Nima to come to what are the nutritional things that can come, lifestyles that can come to help the male infertility. Just for the thing is clomiphene citrate 25 milligrams orally to be given continuously for 90 days. Letrozole 2.5 to 7.5 milligrams daily for 5 days. And this is again the mechanism of action. Again negative feedback. Estrogen negative, positive testosterone and spermatogenesis. Antioxidants, as I have told you, it's CoQ, astaxanthin, vitamins and micronutrients, and nutraceuticals. Please, respected chairpersons, you have the national authority, okay? And we are very much eager to have something, some interaction in this regarding not only we call it as nutraceuticals, but this can be अपने आहार में जो अच्छा है वो लेने से कुछ फर्क पड़ता है क्या, इसका कुछ साइंटिफिक बेसिस करना हो तो ये ज़रूर कीजिएगा. ऐसे मेरी दरख्वास्त है आपसे, क्योंकि आप नेशनल लेवल पे काम कर रहे हैं. सर्जिकल IUI, intrauterine insemination, varicocele repair, open and laparoscopic. ART, I'm not going to talk. Again, PESA, MESA, TESA. And there is micro-TESA, testicular biopsy. Okay. So, conclusive approach. Males first. Okay, evaluation of male first. This is me. Okay, the older the practitioner, better is the convincing capacity. I'm sorry for the young colleagues of me in front of me. They're laughing at me, okay? But counseling needs more of experience, okay? And therefore, if this approach is done by you, you can be more experienced than me, but it was me. This is rational approach. Don't go on hitting everybody. Hey. Okay? Male and female both are important. But at the same time, a rational approach, again I go back, male infertility first. Then this is the integration with which we can do. Okay? This is one sperm entering into one ovum. For one ovum, thousands of active sperms. And for one speaker, hundreds of patient listeners. Thank you very much for for the patient hearing. Thanks a lot. Thank you.
Thank you so much, sir, for this wonderful informative session. Now, I would like to request our respected chairperson, Dr. Dhiman Kamini ma'am, to give her valuable chairperson remarks.
Namaskar. Thank you, sir. It was very nice. But I was thinking something more time should be given to you, and we should have much discussion. It was very nice. Generally, actually, we have infertility clinic at our institute, and we are having lot many patients regarding this male infertility also. And one and two things I was keen to know that what do you think about agglutination in the report of the male?
Pardon me?
Agglutination of sperm.
Yeah, I did not
Yeah.
touch that topic. Anti-sperm antibodies,
Yeah.
which can be the main course of any of the infertility.
This is common thing I have
I'm
observed.
sorry, I haven't touched the immunological part of male infertility today.
Yes, yes.
It's a big
And,
thing.
second-
And genetic part.
Yeah. Second thing, lot many patients are of ED. That is very common in our OPD that they are having this problem. Ayurveda is also very strong in the treatment of male infertility. We are having lot many medications and treatment we give to our patients. But in these two conditions, we get time to treat the patients. And third thing, that was very nice you mentioned that capacitation of this pump. We never have any investigation. We never explore that area. We do research in infertility also and male infertility. We give medicine, we see the result, motility is increased, count is increased, they should conceive. Like that we do generally research, but in next research we will think about that capacitation issue also we will explore.
See, the thing is that the semen has the pH of 7.2. Vagina has a pH around 6.5. So naturally, whenever the sperm is traversing through vagina, it has to have the capacity in spite of the hostile acidic milieu, it has to travel and then it reaches. So
Yeah,
there is a
you told that as per the age increase, spermatid capacity is decreasing in males. That is the very good point you have mentioned in your lecture, and I really will focus upon that also. Yeah, and any question from audience? One or two question we can take. Not more than that. Okay, then we can conclude the session. Thank you, sir.
Thank you,
Thank you.
ma'am, and thank you, sir, for this wonderful discussion. Now we are heading towards felicitation program. I would like to request Dr. Dhiman Kamini ma'am to felicitate our guest speaker with memento and certificate as a token of respect and appreciation. Thank you, ma'am. Thank you, sir. Now, I request Dr. Ramveer Sharma, sir, to felicitate the chairperson, Dr. Dhiman Kamini, ma'am, with memento and certificate as a token of love. I request Dr. Ramveer Sharma sir to felicitate the co-chairperson, Dr. Narendra Meena sir, with the memento and certificate.
I would like to request Dr. Narendra Meena sir to felicitate our MOC of this session, Dr. Prachi Bari and Dr. Vidya Kharat.